Well, good morning again, and thank you for joining us today for the official launch of the Women's Healthcare Declaration. My name is Dr. Christina Francis. I'm a board certified OBGYN and also CEO of APLOG, the American Association of Pro Life Obstetricians and Gynecologists, the world's largest professional medical organization for life affirming women's healthcare professionals. As a physician who has delivered thousands of babies and cared for even more mothers during my nearly 2-decade career, I love the challenge of taking care of two patients at once. APLOG signed on to the Women's Healthcare Declaration because women and their preborn children deserve the best healthcare possible, and they deserve accurate information about their healthcare, as well as the laws that impact that care. All of us can agree on that. Elective induced abortion, which intends the death of a preborn child, does not improve women's health and many times actively worsens it. In fact, induced abortion negatively impacts mental health, causing an up to 7 times increased risk of suicide, as well as an increased risk of depression, anxiety, and substance abuse, even when compared to women who carry an unintended pregnancy to term. Surgical abortions also cause an increased risk of preterm birth in future pregnancies. Maternal mortality, particularly amongst women of color, is unacceptably high in this country. Induced abortion does not reduce these risks. In fact, the way abortions are delivered in this country contributes to worsening maternal outcomes. Because of the FDA's reckless actions in 2021, high-risk abortion drugs can now be ordered online and shipped in the mail to any state in the country. This negligent process leaves women without adequate screening for things like accurate gestational age, ectopic pregnancy, or coercion before they take these drugs, preventing any chance at truly informed consent. It also destroys any physician-patient relationship, as women are left with an invisible and inaccessible provider if they experience complications or for any kind of follow-up care. Drug-induced abortions now account for the majority of abortions in the U.S., despite having a higher complication rate than surgical abortions. The women I have cared for who experienced complications like heavy bleeding, infection, and retained tissue deserved better, and they deserved to know about these risks. Women and physicians across this country also need to know that every state in the country allows physicians like me to intervene immediately to treat miscarriage, ectopic pregnancy, post-abortion complications, and other potentially life-threatening pregnancy complications at any point in pregnancy. For the 76 to 93% of OBGYNs who do not perform induced abortions, our practice did not have to change at all after the Dobbs decision. We continue to provide the same care we have always provided. We can continue to walk with our patients through the best and the worst times of their lives. The only people's practices who needed to change in states with pro-life laws were those providing elective induced abortions. Intentionally ending the life of our fetal patients is not healthcare. Pregnancy is not a disease. Physicians across the country know this to be true and practice accordingly. This is why we joined with 11 other organizations on this declaration: the Alliance for Hippocratic Medicine, the American Academy of Medical Ethics, the American Association of Christian Counselors, the American College of Family Medicine, the American College of Pediatricians, the Christian Medical and Dental Associations, the Catholic Medical Association, the North Carolina Physicians for Freedom, the Catholic Healthcare Leadership Alliance, Christ Medicus Foundation, and the Guiding Star Project. Together, we are calling our colleagues to join us in advocating for the empowerment of all of our patients and to restore to our profession the medical ethics of never intentionally harming our patients and to always act for their good. Thank you.
Good morning. It's an honor to be speaking here today. My name is Dr. Courtney Draper, and I'm an emergency medicine physician. In my 10 years practicing medicine as an emergency medicine physician in the state of South Carolina, I have always been committed to serving my patients, no matter their economic means, health status, gender, or stage of life. This includes when I treat a pregnant woman facing a medical emergency. I recognize that I have two patients, the pregnant woman and her unborn child, each deserving to receive the highest quality medical care. There are those who are spreading deceptive and inaccurate information about state-level laws that prohibit intentionally causing the death of an unborn child. They claim that without a highly permissive approach to induced elective abortion, it is impossible for physicians to treat women facing serious or even life-threatening pregnancy complications. Nothing could be further from the truth. Every life-affirming physician is prepared to intervene to save the life of their pregnant patient, including situations that require separating mom and baby when we face a choice between saving mom but losing baby and losing both. These emergent interventions are not the same as induced abortion, as the intent is not to end the life of the preborn child. State laws recognize this in a variety of ways, allowing physicians to treat patients facing miscarriages, ectopic pregnancies, and all other medical emergencies. This includes my home state of South Carolina, where I have often treated pregnant women facing medical emergencies, requiring emergent intervention, such as ectopic pregnancies and complicated miscarriages. For example, just last week, I treated a woman who unfortunately had a tubal ectopic pregnancy. There was no legal question about my ability to appropriately treat her emergency. In fact, this treatment is not legally restricted by any state's law. As physicians, we are responsible to advocate for our patients and their health. There is an obligation to understand the laws that directly affect our medical practice. There is also a responsibility to bring clarity to difficult medical situations. Treatment of pregnant women with medical emergencies should not be falsely equated with the desire to expand access for induced elective abortion. The Women's Health Declaration helps to provide this clarity, elucidating the record to empower physicians to confidently provide the care their patients deserve. I hope that my fellow physicians will join me in calling for an end to the misinformation about abortion laws and life-affirming health care. Thank you.
Good morning. My name is Robin Perucci. I'm a board-certified neonatologist, and I've been in practice for the last 24 years. I'm also the co-chair of the American College of Pediatricians Pro-Life Committee. Today, prenatal testing is common and expected. It is often ordered as part of a normal routine without question, or done to discover if the baby is a boy or a girl, which means parents are usually caught completely off guard by news of a fetal abnormality, and it is traumatizing. Then, in this state of crisis, they are immediately and repeatedly asked about terminating their baby's life. As an example, let me tell you about Madeline. This little one had anencephaly, an abnormality where significant amounts of the skull and brain are absent. Her mother, who is a nurse and was then pregnant with twins, has given me permission to share this story. She says, in those many conversations with high-risk teams, we were pressured into doing, at the very least, what they call selective termination. Madeline's mother refused. She explains, the part they failed to mention was the unique bond I would have with my daughter, the beautiful moments throughout my pregnancy that are so sacred to me. And you could see her personality loud and clear through every ultrasound. She was feisty. Not only did she make it to 32 weeks and 5 days, but she lived for 1 hour and 34 minutes after she was born. That was the most precious and sacred hour of my life. I could hear her heartbeat and feel her warm skin against mine. She knew she was loved, and that is all she would ever know. A different mother states, this is Luke's mom. My son had a number of abnormal findings detected during the routine 20-week ultrasound. He had congenital heart disease. He measured very small and there appeared to be some neurologic abnormalities as well. While no specific diagnosis could be given for his constellation of findings, his situation was presented as hopeless by a number of maternal fetal medicine doctors and genetic counseling team, and they said it warranted ending his life in the womb. We were offered grim outcomes and a guarantee that our son's life would cause him and our family great difficulty and suffering. Never was our family's happiness and love for our son and desire to parent him, regardless of his health, this was not ever acknowledged. It was not until we met him with pediatric specialists that we realized there were interventions our son could receive. The harmful and coercive effects of the grim misinformation our family received could have led to his termination had we not been completely committed to his life and continued to seek answers and means of supporting him. Our son did pass away at 1 month old from complications related to prematurity infection, but the 4 weeks we had with him remained the most sacred, treasured time of our life. I shudder to think how differently our grieving process would have been without this time with our precious little boy. One more story, and all of these I've been given permission to share. Aurora, her nickname is Ro. She was diagnosed with fetal anomalies and Down syndrome at about 13 weeks. And her mother was told that Ro would not survive the pregnancy due to severe complications, including congenital heart disease and a buildup of fluid on the trunk of her body, which was the beginning of hydrops, which is often fatal, especially when early in pregnancy. Ro's mother says, for several months, I went in weekly for fetal heart checks, fearing the appointment when the doctor could only find silence. But then we found a national organization called Be Not Afraid and met with neonatologists and moms. Ro wasn't a lost cause. Ro's life would and could be celebrated however it continued, whether in our memories or here on earth. As it turned out, Ro was born at 38 weeks and 2 days. She was the biggest baby in the NICU, and she stayed in the NICU for 58 days. She has had 3 open heart surgeries and logged several hospital admissions, but today, she is growing, thriving, and a very smart 3-year-old. She kicks balls and walks like many typical children of her age. This is the future we were never promised. And this future wakes up every morning and greets each new day with a smile. I am so grateful we never gave up on her, and she never gave up on us. Prenatal diagnosis, these are traumatizing to parents, and instead of giving parents the choice of speaking with specialists who care for these children, the only choice they often hear is one of despair and death. Prenatal diagnoses do not adequately describe postnatal prognosis. We do not know until after birth exactly how much or how little any child will be affected by what was diagnosed before they were born. Even when we suspect that there are serious limits to what we can medically offer, it remains our duty to care and not prematurely abandon a little one or their mother or family. And I have never met a mother who regretted meeting her baby, no matter what the diagnosis. Thank you.
Good morning. My name is Louis Brown, and I'm an attorney who serves as the executive director of the Christ Medicus Foundation, a Catholic nonprofit dedicated to sharing the healing love of Jesus Christ through defending medical conscience rights and affirming life-affirming health and wellness programs for the healing of the whole person. I also serve as a board member and vice president of public policy for the Catholic Healthcare Leadership Alliance, a national alliance of Catholic health care organizations dedicated to advancing human dignity and life-affirming care for all Americans. I have been an attorney for over 16 years, and much of my career has been focused on healthcare law and policy, including formerly serving at the U.S. Department of Health and Human Services. The Christ Medicus Foundation and the Catholic Healthcare Leadership Alliance is blessed to partner with this coalition of healthcare professionals to launch the Women's Healthcare Declaration. Pregnant mothers and families deserve to know that life-affirming medical care protects both pregnant mothers and preborn children. The American people deserve to know that pro-life medical professionals and healthcare entities, including Catholic healthcare entities, provide exceptional care that protects the life of pregnant mothers even when pregnancy complications occur. Catholic healthcare entities have provided quality care for millions of pregnant mothers and babies for decades. I know because my mother was one of those pregnant moms, and she chose to deliver me at a Catholic hospital. In 1981, my amazing mother, Sharon, an African-American woman who was then working as a high school teacher, trusted a Catholic hospital in Michigan to safely protect her health and to deliver me by a C-section. My mother, like millions of mothers nationwide, has repeatedly received excellent medical care from pro-life medical professionals and Catholic healthcare entities. Likewise, every year, these pro-life medical professionals and thousands across the country and pro-life healthcare entities provide safe medical care to hundreds of thousands of mothers and babies, even where pregnancy complications arise. Tragically, the abortion industry and pro-abortion elected officials are lying about state pro-life laws, they're lying about life-affirming medical care, and lying about the dangerous reality of abortion. First, the abortion industry and pro-abortion politicians are attempting to deceive the American people by wrongly conflating abortion procedures with miscarriage and other pregnancy challenges. In truth, pro-life medical professionals and health entities successfully care for hundreds of thousands of pregnant moms annually in the face of challenging circumstances without ever having to intentionally kill an unborn child. Second, the abortion industry is gaslighting the American people about what truly endangers pregnant mothers. In truth, every single state pro-life law permits medical professionals to care for pregnant mothers while also seeking to protect preborn children. In truth, states with pro-life laws, in those states, medical professionals and hospitals can safely care for both mother and baby. In truth, it is chemical abortions and surgical abortions that have devastating effects on the physical, emotional, and mental health of patients. In reality, chemical abortion drugs and surgical abortion procedures seriously risk the life and health of pregnant mothers and not state pro-life laws. Third, as the Declaration affirms and these medical doctors testify, the intentional killing of an unborn preborn child is never medically necessary. Abortion is not medical care. Healthcare inherently means loving and caring for patients in their healthcare needs, accompanying them in their suffering, and where possible, restoring the patient to health. Tragically, the legalization of abortion in America has killed over 60 million preborn children, and abortion has killed over 16 million African American preborn babies. Abortion disproportionately impacts communities of color and has been catastrophic for Black people in America. Abortion has also accelerated a throwaway culture in healthcare by undermining the dignity of the human person and medicine, and thereby eroding the civil rights of other poor and vulnerable patients. This declaration demonstrates that life-affirming medical care and pro-life state laws empower dignified care for both pregnant mothers and preborn children. Pro-life medical professionals and healthcare entities provide excellent care to women and preborn children, even when challenges arise. No state law impedes providing medical care to pregnant women. All state pro-life laws ensure medical professionals can continue to protect both mother and baby. Every mother and preborn child deserves dignified and safe medical care. My wife's here with our beautiful daughter. Today, thousands of pro-life healthcare professionals support this declaration, and they show what it means to provide a culture of life in America. This declaration shows that we must reject the darkness of the abortion industry's falsehoods. Today, we tell the truth about the culture of life and love and care in America, where every year, thousands of pro-life medical professionals and hundreds of Catholic hospitals care for hundreds of thousands of mothers and babies across the country. And today, we urge state and federal policymakers to not be afraid to enact laws and regulations that will truly protect the life and dignity of pregnant mothers and babies. Thank you.
So as we conclude today's press conference, I want to thank you all for your attention to this truly life or death issue. As a coalition, we would like to close by sharing our action items. Women should be assured that they will not be prosecuted by any pro-life laws or for seeking care while facing abortion complications. We call on all professional medical organizations to give accurate guidance, free from political influence, on abortion-related laws, as well as to join with us, even if they don't agree with us on the issue of abortion, in seeking evidence-based solutions to improve the care of pregnant women, especially African American women, Hispanic women, and other women from historically underserved communities across the U.S. We call on all hospital systems in states with pro-life laws to quickly and accurately educate their staff about their laws to ensure that women who present with a miscarriage, ectopic pregnancy, complications following an induced abortion, or any other potentially life-threatening emergency in pregnancy receive expeditious and life-saving care. We call on the FDA to instate strict safety protocols on abortion drugs in order to ensure that women have adequate screening and ongoing care if they do choose to take these high-risk drugs. We call on state and federal legislators to enact policies that will ensure accurate and de-identified data collection on the numbers of and complications related to induced abortions, as well as policies that will ensure fully informed consent for women about the risks of induced abortions. We call on all obstetricians to provide improved informed consent before prenatal testing. If a suspected fetal anomaly is found, the inherent value of the unborn child remains intact. Thus, consultations from appropriate experts should be obtained. Because the extent to which the suspected anomaly will affect the baby is not known prior to birth, no family should ever feel pressured to terminate their child's life. Our goal is to help these babies and their families live well for as long or as little an amount of time as they are given. We call on state health agencies to hold abortion facilities in their state to the same health and safety standards that they require of other medical institutions, and to investigate complaints about these facilities that have endangered women's lives across the United States. We invite other medical organizations, as well as individual physicians and medical professionals, to join us by signing the declaration and pursuing excellent and life-affirming healthcare for all of our patients, because women's health matters. And I think we'll take Q&A now.
I think so.
Hi, Joyce Frieden from MedPage Today. I wanted to ask about, you've talked about there's no state law that prohibits doctors from helping women in life-threatening situations. Can you talk about, are there laws where there might be gray areas where it's kind of unclear to doctors? We've heard news stories about women having to wait until they're bleeding out before the doctor will help them. Can you address how doctors are supposed to figure out how to interpret some of these laws?
Yeah, absolutely. Thank you for that question. I think it is really important because, as you said, we have heard stories of doctors being confused. I do not think it is the fault of the state laws. I have looked at all of these state laws with attorneys. I'm a physician, not an attorney, but and all of these state laws use language that has been used in other areas of law governing the practice of medicine. And so the language is actually very clear. Where this has broken down has been the lack of explanation between the law law and the physician. So normally physicians rely upon our professional medical organizations, our state medical boards, our hospital administration to convey accurate information about their laws. Certainly in some states, we have seen this done very well. For instance, recently in the state of Florida, a letter was sent out to every single licensed medical professional in the state, clearly stating when they could intervene. That's an excellent thing that all states should be doing. Unfortunately, that has not been happening, especially right after the Dobbs decision, when many of these laws went into effect. And I think that there's been a very conspicuous silence on the part of many medical organizations, such as the American College of OBGYNs, or ACOG, that has not helped provide clarity to physicians. Again, ACOG and AFLOG, who I represent, may have very different positions on the issue of induced abortion, but we should all be able to agree that women deserve access to emergency care when they need it, and that physicians should feel free to act. And so part of this declaration is to ask these other professional medical organizations to set aside their differences and to agree that we need to be providing clear information, accurate information about state laws to physicians.
Thanks for the question, and thanks for being here. I'd also like to add that the witness and what we've seen for decades of Catholic hospitals, generally from what I could tell, across the country, delivering over 400,000 babies on average annually, they're able to care for women, even in pregnancy complications, without ever having to intentionally kill the unborn child, without ever having to resort to an abortion. And that's in dozens of states, both that have pro-life laws and those that don't. It's just not been an issue. And so I think telling the truth from a legal basis, from a medical perspective, that's what we're doing with the declaration, and that's why we believe it's so important.
Thank you. My name is Josh Beckman, representing Family Research Council. Thank you for being here today. I do have one question regarding the information disbursement of providers, specifically in relevance to the constitutional amendments that are going forth in many of the states. I think we have 10 amendments that are going on this November. And what would be the process going forward if those constitutional amendments were to pass and the language there becomes very vague and broad to possibly not allow physicians to provide accurate information? What would be the setting point with with all these organizations coming together to provide information if those constitutional amendments were to pass?
From a legal standpoint, not being an attorney, just being a physician, I can speak to actually, so APLOG Action, which is our 501c4, has mobilized physician coalitions in 4 different states that are considering these ballot initiatives this fall. So Arizona, Colorado, South Dakota, and Florida. And part of the reason we are joining with physicians in those states is because it's really important for people going to vote this fall that they understand what these ballot initiatives would truly do, which is they would obliterate essentially all pro-life laws in those states. We're already seeing that in Michigan, who passed one of these constitutional amendments a couple of years ago, and now nearly all of their state laws, even on safety and health regulations, are being repealed because of that constitutional amendment. So we know that will happen. Also, as you stated, the language in many of these ballot initiatives is extremely vague. And so I think for physicians going into it, it would be very difficult to know what might be required of them as a physician, especially if they are a physician who will not engage in elective induced abortion. So it's extremely important that people have accurate information about what these would do. All of them are slightly different, but essentially would expand abortion through all 3 trimesters of pregnancy with very minimal, if any, restrictions. And I think the other just important thing to point out is that, again, as we've said, these radical constitutional amendments are not needed for women to receive life-saving care in any states that currently have pro-life laws. All physicians can and should be intervening immediately when they see a woman with a life-threatening pregnancy complication. So, voters need to be informed and make a vote or cast their vote based on accurate information. And if they're worried that these are needed in order to save women's lives, they need to be assured that that's not the case.
This concludes our Women's Healthcare Declaration press conference. If you haven't already done so, please sign the declaration at womenshealthmatters.org. Thank you for attending, and thank you also to our online viewers for joining us.